Good morning, everyone. My name is Michael Hockman. I just want to begin by just saying it's been amazing to watch the home team grow over the last couple of years. The ability to do conservatorship in the field and the support they provide, it's just been a tremendous help to have that guide for mental health medications. I also wanted to thank Mercy for sponsoring this event and giving us the opportunity to present today. And so my name is Michael Hockman. I'm a primary care doctor internist. I worked for several years, about a decade actually, at LA County USC Medical Center, and I worked at Ultimate Health Services Community Health Center. And then for the last 3 years, I've been starting in a nonprofit called Healthcare in Action, which is a nonprofit medical group that's exclusively dedicated to the unhoused population I'm going to tell you about. But because I just thought, since we've just been hearing from psychiatrists and this doesn't apply to this group, I'd start off with my favorite psychiatry joke. So there was a very successful psychiatrist, and he had his 40th birthday, and he went out to celebrate. And tragically, he died in a car accident. And so he gets up to heaven, the pearly gates of St. Peter, and there's a big celebration with cake and balloons and everything, and they say, "Congratulations, you're the oldest person in the history of the world at 160 years old." And he said, "I'm not 160, I'm 40. And the guy behind the gate scratches his head and he says, "Oh, I guess we must have miscalculated when we added up your billable hours." So I know that doesn't count for the psychiatrist on the home team. Okay, so I believe I'm going to start with a video because it's better than me trying to explain what we do.
Been around for several years taking care of the homeless population's medical needs, but one team is taking it a step further.
KCAL News reporter Rena Nakano shows us how they care for clients with the dual goal of health and housing.
Welcome to Robert Horner's office. He's not a driver, not a delivery man. He's a physician assistant.
I used to work in a clinic where we would see a lot of patients every day. You don't make the same kind of connections you do.
His patients are homeless, many who don't feel comfortable walking into a brick-and-mortar clinic, so he and his team go to them. Their first appointment is with Harold. He's been living out of his truck for the last 4 years. He was in poor health until a Cal Optima health van rolled into the church parking lot where Harold was staying.
I was skeptical at first.
But the team met up with him regularly, kept tabs on his medication.
Then I met these people here, and they've been great.
Traditional street medicine has a reactive model where providers treat patients on the street in need of immediate care. This pilot program is proactive, where a primary care provider checks in on a regular basis.
See how that works for 3 months?
But the medical team is just one ingredient of the recipe.
We've got our care navigator with us as well, who is kind of the secret sauce, they say, of our program.
These peer navigators were either once homeless themselves or have some background that's relatable to the clients on the street. They're the ones who coordinate appointments, rides, and guide them through their journey out of homelessness.
This is a medical and a social model combined. It's for individuals that are ready to take the next step in their housing journey and to take them literally from street to home.
The next appointment is with Wyatt, who has been homeless since he was 10 years old.
Yep, I was addicted to fentanyl.
The team says at first, Wyatt was not receptive of their offer. But their persistence over the last year worked. He's now off the drugs and his medical needs are being managed.
Wyatt says this was his home for the last however many days, but he says better things are on the horizon.
I can't believe it myself if it's all good right now.
His peer navigator, Jasmine Garcia, has set up an interview with a recovering and housing program for older adults.
I'm kind of hoping they're going to take me in right now.
In the last year, this pilot program has regularly cared for more than 200 patients in Garden Grove. But starting this August, they'll expand into Anaheim and Costa Mesa to help more people like Wyatt.
To see where he's at today, where he's fist bumping us, he's like thanking us, it's like night and day.
His interview, by the way, went very well. For the first time in 50 years, Wyatt is no longer homeless. Proof that there is hope, even in the darkest of times.
What do you think the most fulfilling part about your job is?
Seeing them kind of at their lowest point and being able to actually help them.
In Garden Grove, I'm Rena Nakano, KCAL News.
So I'll give a little bit of an overview about our organization, our outcomes to date, the business model, and we actually started with the video. So you can go to the first slide. So what we try to do is bring care to unhoused patients where they are. So I like to say we are a community health center on wheels. We can do 80 to 90% of what would happen in any community clinic. We go to street encampments, we go to shelters, we go to interim housing. We provide general medical services, so this could be wound care, it could be pain management, it could be diabetes, high blood pressure care. It does tend to be more on the urgent care spectrum of things, but we do consider ourselves, and we are qualified by the health plans to be a primary care provider. Now, in terms of the mental health piece, we are not psychiatrists, but we have learned that when you're out there with the patient, point of care, you got to do as much as you possibly can. So we've hired psychiatrists who, under their guidance and consultation, we can initiate, adjust mental health medications. We start medications for schizophrenia and bipolar. We call our good friends from the home team when we have tricky situations. We do a lot of injectable medications, so we don't have to worry about daily medications. And shout out to our pharmacy partners who've been really helpful with us getting those medications out in the field. We also do a lot of substance use treatment, so a lot of medication-assisted treatment, Suboxone, Sublocade, and it's been really great to see the technological advances. There's now some of these injectable medications that will last for 6 months, that you can give an injection and that will give the patient the treatment for 6 months. There's now 3-month versions of buprenorphine, which have just really been a huge advance. And then the final thing we do is case management. So our strengths, what we're best at, is the medical care side of things, but sometimes we're out in the field and we're the only ones there. And the most important thing for the patient's health is housing. So we're able to get the patient enrolled in the coordinated entry system, matched into a shelter or housing. And whenever we have a partner, we have some great partners, Weingart, the People Concern, Hope of the Mission, on, Women's Health, Downtown Women's Center. We love working with them, let them do it, but sometimes we're in the field and we have to do it ourselves. So in the field, we have typically a nurse, a primary care provider, and then really the secret sauce to our teams are, we call them peer navigators or community health workers. And they're the ones who do all the coordination, getting the patient's medication to them, talking them through problem solving. They spend a lot of time at the DMV getting driver's licenses replaced. And quite frankly, that's probably one of the most important things for their health, right? Because if we can get that in place, then they're going to be in a much better environment. Next slide. So highlights today, actually this week, we launched our 16th team in Riverside County. 16 teams in 6 counties. By the end of the year, we're going to be at 20 teams. We've served about 6,000 total patients to date in just over 2 years that we've been providing care. One of the statistics I'm most proud of, you saw one of them on that video, we've had 500 patients successfully placed into housing, and that could be either going from the streets into a shelter or interim housing, or we also count it as a success if you go from an interim housing into permanent housing. This is an inside baseball statistic, but the Net Promoter Score, it's the question, would you recommend this service to a friend or neighbor? And healthcare organizations typically hover around 20 for Net Promoter Score. I've heard that Netflix has a Net Promoter Score of 48, although I'm not sure I'd give it such a high grade these days, but that's neither here nor there. And so we had a Net Promoter Score of 86, which I think is a testament to just how effectively our team connects with the patients, and also how low the bar has been historically and how much patients do immediately appreciate what we do. We contract with health plans. We have 6 health plan contracts: Cal Optima, LA Care, Molina, Inland Empire Health Plan, and a couple others. We have health system contracts. A big shout out to Cedars-Sinai, Providence, Optum have all contracted with us to help stabilize their unhoused patients. One big surprise to me is the cities that have reached out to us. So the Riverside County, the City of San Diego, City of West Hollywood, Culver City, City of LA, they've called us and they said, we want another team. We know, your revenue reimbursement doesn't quite cover your cost. If we give you a contract to subsidize what you do, can you put a team here? And then the VA has contracted with us because the VA has great resources for veterans once they get on the campus, but there's a lot of disconnected veterans. So our job with that contract is to get those veterans reconnected to the VA system. Next slide, please. So we have some encouraging preliminary data. This is from the first 99 patients we got at Cedars-Sinai Medical Center. We looked at revisit rate, what percentage of these patients get readmitted to the hospital or come back to the ER within 30 days. And they did some statistical adjustments that are beyond my comprehension. But the statisticians concluded that there was about a 24% reduction in repeat visits among the patients assigned to us versus matched controls. Next slide, please. All right, so the fun part is, I think we've been happy with the clinical outcomes. We think we're doing, something that's really filling a gap in the system, providing care to a lot of people who need it, having a lot of success with the housing side of things. It's not cheap, as you guys know, to provide this service. In fact, comprehensive street medicine care, mobile health care, costs about $10,000 per patient per year if you really do it comprehensively. I think if you really go lean, you can maybe get it down to $7,000, but I'm going to say $10,000 because it's a round number and always better to start negotiating a little higher. And that's about 10 times the rate of a typical primary care provider. And just another way to make this sink in, when I was in practice at Ultimed and USC, a typical primary care doctor like myself would have 2,000 patients. Well, our medical providers have 200, so it's about a 10-fold higher ratio to provide these services. And so to be cost effective, we obviously need to target it to those who really, really need the service. So next slide. So how do we do this? This is an ideal model. It doesn't always work out quite like this, but we've really benefited a lot from CalAIM. And if we have a patient enrolled in the Enhanced Care Management Program and housing navigation fees, we can actually generate very significant income. Now, the reality has been a lot of blocked claims, and not everyone enrolls in all three of these CalAIM programs. And if anybody has questions about CalAIM in the question and answer, we can talk about it. But it's really been allowed us to do this work that we otherwise wouldn't. But we are still not achieving that, so we do rely on those city and county grants and some philanthropy. And I should acknowledge our parent organization is the SCAN Group, which is their community benefit, has backstopped us with philanthropic donations.